I'm Malu Romero. I came from Abukay, Bataan. I used to work with General Motors as an executive assistant before I joined Insular Life. Being with the Insular Life for the last 38 years, I realized that the best way you can really serve Filipino families would be to become the best of what you can become. Of course, health insurance is very, very, very important. You know why? I experienced 2 deaths in my family due to cancer. The first time was when my husband was diagnosed to have leukemia, and at the time, he was employed with a very prestigious company. They have their own company coverage, and yet it was not enough. Out of the 100%, I have already paid about more than half of what I should really pay to the hospital. Because he had a retirement program, most of the hospital expenses were deducted from his retirement program. If he didn't have an HMO and a retirement program, it will be difficult for us to be able to move on. The second time was when my mother was also diagnosed to have cancer. At one point, my mom would ask me, "Anak, kaya pa ba natin yan?" Kasi nagkikimo siya almost every month. Sabi ko, "Nay, pera po lang yan. Kikitain po natin yan." Alam nyo, when she asked me, kaya pa natin, I am just really so blessed. I'm so lucky and grateful na I am in the life insurance industry. If I tell my clients, you have to really save for the rainy day, I have to also walk the talk. I always have our emergency fund to take care of whatever emergency that will arise. The rule is, if your expenses monthly is about 100,000 a month or 50,000 a month, dapat po meron kayong 6 na buwan na expenses. So 6 times 50,000, you should have at least 300,000 in the bank. I-set aside na po natin yon para meron tayong emergency fund. Having said that, when my mom was hospitalized, I made sure we have the money to pay for it. And then recently, I was diagnosed to have pancreatitis. I was in the ICU and I stayed in Makati Medical for about a month and a half. My bill was 1.8 million. Kung wala po akong HMO, which really helped a little bit, my PhilHealth, I paid about 1.3 million for me to get well. That's the value of having a forced savings. And then recently, I was talking to my client who had a knee problem, and he's now age 75. And I said, "So, okay ba ngayon ang pakiramdam mo?" Sabi niya, "I am due for kidney transplant." And I said, "Magkano na nagastos mo?" Sabi niya, "About 10 million already." So my gosh, gano'n na ngayon po ang magagastos pagka nagkasakit. So ang tanong ko, are you prepared for this emergency? Friends, importante ho, meron tayong emergency fund. Kailangan mo magtabi para sa health insurance, para you're always prepared kung ano man ang eventuality na mangyari sa iyo. Okay?